There's an enormous amount of academics that have reported mental health problems. And there's something about academics, people who are interested in intellectually exploring a topic. We don't really like talking about vulnerabilities in the workplace. And before you think this does not apply to you, we are often the tip of the spear for other professions. Hello, welcome to another episode of the Crossover Connections with Jack Wang podcast. My name is Jack Wang. I'm a scientist and college professor based in Australian University. And this brings me to our recurring segment on the podcast, Whose Job Is It Anyway?, where we try to explore how the most recent headlines tie into our professions and the jobs of the future. And this article is, again, not a super optimistic article. It's a bit of a downer. I don't want this episode to be a downer. I don't want this podcast to be a downer. But it talks about mental health in my profession of academia. The pandemic, the global pandemic in 2020, exposed some risks and vulnerabilities of mental health that were there all along. You can find this article via the link in the show notes. The main takeaway, the main thesis is that mental health in academia has never been worse. And mental health, I think, across the world has never been worse because it's made the underlying cracks much more visible. This is not a sob story. I'm an academic and I've had my fair share of mental health issues over the years, and hopefully I'm coping with them okay at the point that this podcast has been uploaded. But we are in a competitive sector where there's a lot of work, and the workload is not your typical workload. It is not a 9-to-5 workload by and large. You get to decide how much of it you're doing on a certain day, but there is never an end to the day in terms of, hey, I've done everything I need to do today. We're often working on projects that take months, if not years, to mature. We're working towards an end goal that is not right in front of us. And that is a huge trigger for people with anxiety and depression. If you don't know what you're working towards in the short term, and there are these lofty goals that you don't really see day in, day out, that can put a lot of innate psychological pressure on people who have these underlying mental health vulnerabilities. And there's something about academics, people who are interested in intellectually exploring a topic. That Venn diagram is almost a perfect circle, I think. There's an enormous amount of academics that have reported mental health problems. And in 2003, 24% of the sample of academics had substantial level of psychological distress. A 2017 report, 37% of academic staff had mental health disorder. A British study, 43% of academics in sample had symptoms of a mild mental disorder, which include depression, anxiety, and burnout. And in this particular article survey, it was up to 2/3 of academics are expressing mental health issues. So this is really very pervasive in our sector. You could extrapolate out to other sectors, but that's the sector I know the best, my own sector, so I'll speak on it. The vulnerability that we're under is that we are a numbers-based, metrics-based sector. And before you think this does not apply to you, we are often the tip of the spear for other professions. We are so filled with smart ways of outsmarting ourselves that the things we implement in academia often trickle over to businesses, right? And businesses are often what regulate jobs that people who aren't in academia do. Collecting a whole bunch of data on how effective we are, how many papers we publish, how many grants, if we post on social media, how many clicks, how many likes, how many integrations do we have. So we are so smart that we figured out how to rank ourselves, our universities, our individual staff. That has been weaponized against us. And this kind of data trend is bleeding over into every sector. So it's in sports. You want to know what your percentage of getting a certain shot in the basket is. So only take shots from this angle at this point on the court. You want to know, hey, if I'm selling pizzas, how often does this particular pizza sell on this Wednesday night in this area of the world? Every business has been driven by data and driven by analytics. So we are constantly being evaluated by data. And that is not great for people with underlying mental health issues. Now you're constantly being judged. There are all the typical vulnerabilities that come along with gender inequality and minorities in general. If you're of a different race or ethnicity or sexual orientation or gender identity, this compounds it. It doesn't replace the pressures that you're under. It just compounds it. It adds a certain percentage, multiplying on top of the existing issues that we already face in our sector. Of course, the other one is the invisibility. Because we're in a competitive sector, no one likes talking about it. I started talking about imposter syndrome to more and more early career researchers in whatever mentoring capacity I have. And this is something that is real, and it really causes people to feel like they don't belong in a very competitive sector and exacerbates all of those mental health issues. But we can't really talk about it. It's just not really the done thing. We don't really like talking about vulnerabilities in the workplace, and we all want to be the one that shows up even on our sick days. That's a very stereotypical view of kind of the true warrior that guts it out even under duress. Again, academia is often a preview of what all the other sectors are going to experience in the near future, because we have evolved in certain discussions quicker than many, many other industries. And often it's going to come for you next if you see it happening in academia. The direct action that this article is proposing to solve these mental health issues, standardization of some frameworks around mental health to make more visible the supporting resources that people can access, whether they be students or staff for mental health. But they'll run into that same issue. There are not enough trained mental health professionals in any system that can help the people and give the people help in a timely manner. There's just not. So again, I'm imploring anyone who's listening to this who has even a glancing tangential interest in mental health to consider this as a career path, because there is a huge demand for it in the world, and that demand is not going away anytime soon. And if you don't want to work in it forever, even having an understanding of mental health is going to bleed over into your everyday lives, because odds are the people you work with, the people that you connect with, whether they be your clients or students or seniors or really young people, they will have mental health distress on some level. And if you can understand what they're going through, you will be able to communicate with them that much more effectively. I don't like to pose problems without solutions. So here is my solution to conclude this episode of the podcast, what we can do individually to really help mental health in our everyday lives. Is it going to be a lot more money investing in mental health? That's part of the solution, definitely, but it's not enough. Systemic investment in mental health is not enough to get us across the board, because there's a case study here from the conversation where New Zealand pledged $1.9 billion in 2019 to improve mental health services. 4 years later, it's clear that the high hopes of transforming that sector in New Zealand have not yet worked. Waiting 70 days to be seen by a therapist, to men struggling with depression and chronic conditions with ADHD, not even getting diagnoses and care. So money alone is not enough. You can't just throw money at the problem. You have to really understand where that money is going. In New Zealand, they gave the money to health improvement practitioners and health coaches based within general medical practitioners, and giving them early access, presenting to their GP if you've got a mental health condition. And they also invested in mental health apps, making them widely available to the public. Again, we talked about this. The apps are good, but the problem is there's not enough mental health professionals that you can connect to via the apps. People who go to mental health, they are existing healthcare workers from a slightly adjacent area of healthcare. So the article says it's akin to robbing Peter to pay Paul, and the health workforce is not an infinite resource. There is only a finite number of people who have the capacity to go into this kind of work. Clinicians are just moving from one area to another. They are not actually creating more and more mental health practitioners, even after the investment of $1.9 billion. What on earth is the solution that Jack is proposing that governments and large multi-million-dollar companies have not yet come up with? Comes back to what we can do individually in the moment to assume responsibility for what we can control. And that is to understand mental health better. Do so in service of those around you. You do not have to become a licensed mental health professional, although if you have the capacity to, please go ahead and do it. I'm a college professor and scientist. I have no official training in mental health, but in Australia, we have a mental health first aid training program where you can go and take a course from trained and licensed instructors, where these mental health professionals, they're training more mental health advocates. And that really has the model of scalability. If you go and take these courses and you then become an instructor, you need to train more people in becoming mental health and to teach other teachers to become advocates and instructors of mental health. That is the model that will work and be scalable to really make it much more effective. I'm not a mental health professional, but I at least understand the basic tenets of mental health first aid and what you're supposed to do. And after doing this mental health first aid course, I'm not afraid to have the conversation with people in my life that have mental health issues. And that is a huge step forward in the right direction. You do not have to become a fully vetted and qualified mental health professional to have an impact on mental health in your life and the lives of those around you. Understanding more about the problem, and that can have an enormous impact. Learning more about mental health so that you're not afraid to raise awareness and support those around you, even with your limited capacity. And then you can direct them to the right support services, which hopefully over time will continue to expand. It's not just throwing money at the problem. You have to know strategically where to spend your time and resources if we're going to improve our mental health overall in society. I'm Jack. Hope to connect with you again next time around.